Dry needling is growing in popularity. The up-and-coming technique uses tiny needles to treat and manage pain. Well, Linh Bui has more on the treatment one woman calls life-changing therapy.
I'm basically using my fingertips to try and get to some of these muscles that underlie the back of her skull.
A car accident last year left Sophia Fuchs with nerve damage and debilitating headaches that kept her in bed all day.
We tried different medication, but nothing helped. And my doctor recommended perhaps I should do surgery. But I was not thrilled in doing surgery right away.
Doing great.
Instead of surgery, doctor of physical therapy Simeon Mellinger at Sinai Hospital began using a technique called dry needling.
So what did you think when it was recommended to you?
I said, hey, why not? I'll try it. I have nothing to lose. But of course, the thought of having a needle going into my back, it frightened me a bit.
Maryland was one of the first states to allow physical therapists to dry needle patients.
What is dry needling therapy?
So dry needling therapy uses a very tiny needle, we call it a monofilament needle, and it's similar to an acupuncture needle, except we target trigger points within the muscle. And a trigger point is essentially a muscle knot that refers pain elsewhere.
Mellinger says the pain from the needle feels similar to a Charlie horse.
I would say the pain is minimal to moderate, and it only lasts a few seconds. And really, the patients that come to me, they're at the point where they'll do anything to get rid of the symptoms that they've had.
Once the needle is in the trigger point, physical therapists can connect it to an electric current.
We can increase the intensity of that current to get the muscle to contract and relax. And we find it has a bit of a neuromuscular effect on the muscle to get it to calm down.
Dr. Jan Dommerholt, president and owner of Bethesda PhysioCare, was the first person to teach dry needling courses in the U.S. in 1997. He says he's seen the technique's popularity grow exponentially.
It becomes very popular because it's so effective. So I think that more and more physical therapists and chiropractors and now occupational therapists more and more are improved to do this. Athletic trainers even in several states now can do dry needling. I think that all has contributed to this very sudden growth.
Dry needling is typically part of a larger treatment plan. With their pain diminished, patients can do therapeutic exercises and strengthen the muscles around the joints.
And not just this magical little stick with a needle. Yes, it helps a lot, but if patients don't change what they do after to take advantage of that new ability, it's probably not going to be that effective.
After 4 weeks of dry needling, Fuchs' headaches are more mild and happen less frequently.
In the past, when I would have these terrible, terrible headaches, I would stay in bed and try to sleep all day. But now I feel much better. I don't need to go to bed and just stay in bed all day because it has helped me.
So it's completely changed your life.
It changed my life, and I hope I will get rid of my headaches completely. That's the goal.
Now I'm going to take the needle out.
A turning point in her recovery.
Needle's out.
You know, Lynn, this almost seems to combine Eastern medicine and acupuncture with Western medicine and technology, the electronics of it.
I know, it reminds you of acupuncture, right?
Yeah.
It's quite different. Acupuncture has been around for, what, hundreds, thousands of years. It's all about relieving pain by opening up your energy flow. And then this is actually, dry needling, a very modern practice. And you've got to enter these trigger points with the needle to relieve pain to kind of affect the muscle. So, very different.
Well, and I guess more people are getting used to this idea. I mean, it's becoming more commonplace.
It's becoming very popular, and the doctors were telling me that professional athletes, it's very popular with them. They say every major sports team has a dry needling physical therapist on staff.
And while it does look a little painful when you see the needles, it makes some people squeamish.
Yeah.
Really, it seems that it's not very painful in the scheme of
They say
things.
moderate discomfort or pain when the needle enters, but then once it's in, you don't feel it anymore. That's what they said.
Okay, well, certainly something that's going to expand the options for folks who are looking for that
It's
relief.
another option to explore if you're in chronic pain.
Yeah, okay. Wow.
And we'll be right back after this with more news, traffic, and weather.